I got a DM recently and we thought this would be sort of a worthwhile thing to address with a video. And the DM read, "Do you ever have not so great outcomes? And if so, how is it resolved?" And I had a lot of thoughts about this that I wanted to share. So first and foremost, any surgeon who says they don't have outcomes they're not happy about is either lying or they haven't operated enough.
And the truth shall set you free!
So absolutely it does happen, and I'm not gonna lie, it sucks. It's not a comfortable situation for anybody. Fortunately, it doesn't happen a lot, but I wanted to address that issue, address issues surrounding it to give people an idea of how to approach it, and certainly my thoughts and how I approach it. So first of all, from the patient standpoint, I think there's a few things that are important to acknowledge. First, anytime you're having elective surgery, you're accepting some element of risk. This is just an imperfect world where we're doing a procedure on a healthy person. There's a lot of variables in and out of our control that can affect the outcome. So when you sign on for elective procedures, there is an element of risk that you accept. Now, obviously, as a patient, you're going to do things to stack the odds in your favor, picking a provider who you have confidence in, who you have a good rapport with. All these things are putting yourself in the best possible position to have a good outcome. Nonetheless, it can happen. So in those situations, these are some general things I advise patients in terms of advice I would give. Number one, when you're in a consult or in the position of the consult, I think discussing expectations before the surgery is extremely important on both sides.
I don't think I will. I just want it to look natural.
Well, of course they'll look natural. They'll look more natural than what you have now. You see, beauty is about proportion. You're very, very bottom heavy.
I think on the patient side, you want to convey what your expectations are, and you want to have a really good understanding from your surgeon what they're telling you in terms of what to expect afterwards, what you should expect from your result, what are some potential pitfalls that you may face. So that's number one. Number two, you need to be patient after your procedure. I think people that come in at 1 or 2 weeks and are concerned about something, way too early to be worried. So you need to be patient with your result and give it the time that it needs to get to that final point of the result. The third thing is communication, and this cannot be overestimated. Having real, genuine communication with the provider and their team throughout the process about what your concerns are, where you're worried about something falling short, is extremely important. We can't always read your mind, so we need to know what's going on in your head about what maybe is on your mind that's bothering you, and starting that discussion early so it's something that the team can keep an eye on as you continue to heal. Now, from the surgeon's side of things, how do I approach this? Now listen, as someone who's passionate about what I do, my happiness and fulfillment in this job rests very, very predominantly on how my patients are doing and how happy they are. So I take it very seriously. It's a position of vulnerability. And just from the human side, it's almost hard not to be hurt when someone's not happy. I'm really invested in my patient's happiness. So the way I approach this, largely the things I said before, being patient, giving the result time to manifest, communicating with my patients about sort of what they should expect and what things should be expected to change, and also being very clear about expectations before. Now, when I encounter a patient who's not happy with something, obviously this is going to be done on a case-by-case basis. Frequently, in fact, most cases, there's something that we can do to address areas that are problematic. Sometimes that's something that's just done in the office. Sometimes it's going back to the operating room. So again, this is going to be discussed with each patient, but ultimately we want to do everything we can to get them happy. Some of that is communicating what's doable and what's not, but obviously in situations where something can be done, you damn well can be assured that we're going to do it. I hope that makes sense.